recording will only be provided to the Planwari course students because we cannot provide it to our free students just because you don't have an account with us. That's the only reason. Yes, maybe later on, if we converted it to a YouTube video, we can surely make it available for everybody. Okay. Now, uh, this is just an intro session which we planned for basically for Planwari LDS Part 1 students who have passed. And first of all, congratulations to all of you. Uh, because passing part 1 is a very, very big step in getting registered with the GDC. And now moving on to part 2, we wanted all of you to have an idea on how to go about it. But because we had some seats available, we have also offered it to the free group students, those who are interested in knowing. So we will be talking about the two main components, that is the OSCE and the unseen cases. And we'll also be talking about how Planwari would conduct courses or how we would teach you in case you join us. Okay. So with that, let's begin. I hope everybody in the class can by now hear and see the Microsoft PowerPoint. Okay. Uh, okay. Now, guys, if anybody of you cannot see on the screen because of any reasons, there is a zoom button on your screens for the ones who are in the live class. Make sure you reduce or increase your zoom depending upon your laptop, iPad, phone, whatever you're seeing. Okay. So the PPT says what are the two components. Is everybody able to view this? Now there are two components. All of you know LDS Part 2 has two components, unseen cases and OSCEs. Okay. And I know a lot of you are friends with DTP candidates. A lot of you are doing ORE and LDS simultaneously as well. So I'll just tell you the difference with ORE in just a minute or two. No, I won't waste your time on that. Just so that you understand when someone is speaking about ORE and when someone is talking about LDS, you can understand the difference. Because when we receive queries on our website or on WhatsApp, students themselves are a lot of confused between what they actually want. Okay. Uh, Enable audio off. You are you not able to hear me? Okay, I'm not getting a response. Not sure. Okay. So, ORE guys has DTP, OSCEs, and ME. Now, it is very similar to LDS because LDS and ORE are basically registration exams. So they are trying to what you say assess you on the same aspect, but in a different format. For example, LDS will have unseen case and OSCE. Okay, we are not talking about mannequin at all, and ORE will be having three components: DTP, OSCEs, and ME. So you can see OSCE and OSCE is very similar to ORE and LDS. But the DTP, which is in ORE, full form is Diagnosis and Treatment Planning, is changed to unseen cases in LDS. So it is very similar with a small difference, which I'll explain. And medical emergencies, which is in ORE, it comes as an OSCE in your LDS. Okay. So instead of ME giving a separate component for LDS students, it is a added component with your LDS. Okay. But when we do any courses, we will be doing separate courses for OSCE and separate courses for ME. So this is the main difference between OSCE, ORE and LDS. Now let's move on with the LDS. The first component we are going to talk about is the OSCEs. Now, all of you still able to hear me, right? Still able to see the Microsoft PowerPoint? Okay, great. So what is an OSCE? Can anybody tell me the full form of OSCE? Anybody? Anybody who has read the structure of the um, what do you say, of the exam? Yeah, use the zoom button, guys, because if you're watching on a different iPad or iPhone, you will have to use your zooms to adjust the screen. Nobody? Okay. Okay. Objective structured clinical examination. Yes, OSCE is objective structured clinical examination, but we call it OSCE. Okay. We don't call the full form. Now, what is OSCE? OSCE are small, small stations. Okay. So they assess you on different things. They assess you on how you talk to a patient. They assess you on your theory knowledge on certain aspects. They assess you on skills like rubber dam application, suturing, splinting, and they also in LDS assess you on performance of a medical emergency. Okay, so these are the main things where they perform you, and they are very short stations. They are just 7-minute stations, and you get 7 minutes to show uh, whatever they have asked. Yours, the skill, the knowledge, the way you speak, whatever they have asked you to do, you just have 7 minutes to prove your point. Okay. The good thing is in an LDS you only have 12 stations. 12 stations is good because in ORE you actually have 20 to 25 stations, which can be a little difficult. But yes, because the number of minutes are high in LDS, in ORE it's 5 minutes, here it is 7 minutes. So you can say it weighs out to almost the same thing. OSCEs in the olden days, or you can say before 2022, it used to be for 5 minutes. But now, because they have changed the structure, I'm sure all of you know that they have now changed it to 7 minutes. So they have increased the number of minutes for every station. So, how does this happen? So, now this happens in a circuit. Yes, you do have rest stations, but here they have not told you about the rest stations. Okay, this is for 12 which you have to enact. Plus, you will be having 3 or 4 rest stations in between. That will depend on your examiner on how much he or she decides to give you in between. Okay, but 12 will be on which you will be judged on. Okay, now in a 7-minute station, again, this is very difficult for me to tell you because the problem is the LDS website has not been very clear on how many minutes will you get to read the question and how many minutes will you get to perform the OSCE. But based on I did talk to a lot of LDS students who were about to give their exams in June, which got postponed. So they said that they will be getting 1 to 2 minutes for reading. Again, they were not sure whether it is one or two. Hopefully, LDS exam will make this clear before your exam. But I think if you're going to perform for 7 minutes, they should give you 2 minutes for reading. This is very similar to your membership exams because membership exams have 2 minutes for reading and 8 minutes for performance. So I think you will get 2 minutes in an LDS, but we will have to wait for the LDS website to release the exact details, or we will have to wait for the first exam to happen, which is in the month of October, and then we will have an exact view because they have changed the structure. So we'll have to wait for that. So you spend around 1 to 2 minutes for reading the question. In the question, they will tell you exactly what they want you to do. They want you to talk to the patient. They want you to tell management whatever they want you to do. They will tell you. And in those 7 minutes, you have to perform whatever they have asked. In those 7 minutes, an examiner will be examining you. If it is you're talking to a patient, the examiner will be assessing you. If you're performing a skill, the examiner will be assessing you. The only station where an examiner will not be will obviously be a rest station and will also be a written station where they have given you a set of questions and you have to write down the answers. In that you don't require an examiner. An examiner will assess your sheets later on like a written exam. Okay. Why you have around 20 stations? Okay. Around which 18 stations you are assessed, 20 stations are pilot stations, and totally you at least have 26 stations where 6 stations are rest. And they are all 5 minutes. So OR is a huge exam. It takes around 2.5 hours. This I think will be a little smaller, but still, because it's 7 minutes, you will also end up getting tired. The problem with OSCE exam is you are very good in the first 4 or 5 stations, but as you keep going ahead, because your energy reduces, your the power to think reduces with stress and obviously with time, uh, you start uh, performing a little less in the later stations. So what we tell in the courses is you have to perform 12 OSCEs in the at home also. When you book an exam, do 12 stations in what you say one after the other so that you have that practice. You can develop that much of stamina and energy to perform the same in your exam as well. Okay. So those were your something about your station. Any queries so far in this one? Any queries? Should I go ahead? Okay. Now, mainly the OSCEs are divided into actor OSCE, written OSCE, and skilled OSCE, as I earlier told you. Planore has also made specific videos on OSCE, actor OSCE, written OSCE, and skilled OSCE, which are on YouTube. And you can obviously watch there if you want to know about it in detail. Okay. But I will be talking a little bit about them here as well. Okay. Now, it can either be actor, it can either be a written, it can either be a skilled. Every station will be different. So it may either be oral or written. Okay, so like three stations will be actor, three stations will be skilled, and three stations will be written, something like that. Now you move in a circuit, as I told you. Okay, so you will have a circuit of 12 stations. Now, all 12, there will be like, I'm just giving an example. Say there are 12 stations, they will have 12 people, one person in front of every station. Okay, just imagine there are 12 booths, there are 12 people standing in front of every booth, and then they will start a timer. In the timer, say you have 2 minutes for reading the question. In front of your booth, if this is your booth, in front of your booth, there is a question attached on the wall. It is stuck to the wall. You have to read your scenario. Okay. And once you read the scenario, then you have to go inside and then you have to perform your OSCE. How will you know how many minutes are over? They will tell you by the way of buzzers. Okay, so you will have a buzzer at the end of 2 minutes. That means you have to now go inside and perform the OSCE, which can be an actor OSCE, a written OSCE, or a skilled OSCE. Once you finish the OSCE, after 7 minutes, they will again give you a buzzer, which tells you your time is up. You come out from the first station and you go to the second. Okay, so the person on second will go to third, the person on third will go to fourth, and this will continue. So this circuit goes on till the first person has, till all of you have finished 12 stations basically. There will be a little more obviously with rest stations, but once all the stations everyone has completed, the exam will stop. So there is no break in the exam except for rest station. It goes on continuously in a circuit. Okay, so all of you understand this? Yes. Okay, now I'll talk a little about written OSCE. Now what is a written OSCE? So let's take an example. You have a written OSCE on basic periodontal examination. So they may tell you in the question what you're supposed to do. So they will tell you that you're going to get a few pictures on basic periodontal examination, and you have to answer them. And then in your question paper, which will be inside the main room, you will have a question, you will have pictures, you will also have an answer sheet. Okay, so on the answer sheet, you have to start writing the answers for the question. So, like here, it says you have to tell us the BP scores for pick 1, 2, and 3, right? So, you will look at these pictures, you will tell their BP scores. Then, your question is what is the treatment plan? So, you'll be telling the treatment plan for all of them, writing it, sorry, not telling, writing in. Which probe is used? So, you will write the name of the probe, which is a CPITN probe. All of you know this probe, right? So, we are not going to study the theory aspect of this because the class is not intended for that. So, you will write about the probe, and you will, what are the markings on the probe? So you will describe the two black bands of the probe. Now all these questions need to be answered in 5 minutes, in 7 minutes for a LDS OSCE. So obviously according to 7 minutes they will give you around 5 questions, 7 questions, 8 questions, depending upon, they will assess beforehand whether somebody can finish it in 7 minutes or not. So they will make sure that they make an OSCE in such a way that you have to be uh, you can finish it in 7 minutes. Once you finish it, you they will tell you whether you have to leave the paper there or you have to take it with you. They will tell you all those things. You don't need to worry about it. But the main thing is after the 7 minutes, you cannot make any changes in the answer sheet. Okay, don't do it. Even if you want to sneak or you want to write, add something, don't do all that because they have cameras everywhere, and unnecessarily if you get caught, unnecessarily your exam will get wasted. So don't If they have given you 7 minutes, use only those 7 minutes to answer. Okay. So when we in the course we tell you to keep a timer of 7 minutes and practice writing, because most of us have don't have a lot of practice in writing. We are so tech savvy nowadays with laptops and mobiles and iPads that none of us write. But in the exam you will have to. Okay. Actor OSCE, how will an actor OSCE be? They will give you a scenario. The scenario can be, your patient has a lower third molar. She is having a third episode of pericoronitis, and you have done everything. What you have to do now is you have to tell the diagnosis and the treatment planning to the patient. You also have to provide sedation options to the patient, and you have to take consent for the procedure. The scenario can be anything. Okay, there can be different types of scenarios, and there are various scenarios in the OSCE, actor OSCE. It can also be a medical emergency. Like I told you, in an LDS exam, it can be an ME as well. But right now, I'm not talking about ME. Right now, I'm talking about all actor OSCEs except ME. We will come to the ME scenarios later on. So, in an actor OSCE, you get 1 or 2 minutes to read the scenario. Please read the scenario carefully, because they may give you a lot of information which you need to understand before you can go inside and talk to the patient. Then, when you go inside, you greet your patient, and then whatever has been asked for you, you start. If they have told you to tell the diagnosis, then you tell the diagnosis, treatment planning, sedation options. Now, what are they looking for? They are looking for whether your management is correct or not, whether your diagnosis is correct or not. They are also looking for whether you're explaining it to the patient in normal layman terms, or are you using jargons. Like you may say the patient has, you have pericoronitis, and we need to remove the impacted tooth from your mouth by doing a minor oral surgery. This won't make sense to the patient because you use so many jargons. You used impaction, pericoronitis. These words don't have any meaning for the patient. So you have to explain it as you are explaining it to someone who has no idea about dentistry. So that is communication skill. At the same time, are you just delivering a speech? Like, some people by heart the material, go inside and vomit it out. If you do that, they are not going to mark you, because they don't want you to buy heart stuff. They want you to talk properly. They want you to communicate properly, because that is what you will be doing when you will be actually practicing. So they will be looking for communication skills. They will be looking for empathy. Do you really empathize with the patient's issue, or are you just there for the sake of an exam? So I know empathy may not come immediately. Empathy is, a little what you say, difficult to come for an actor patient, because an actor patient is acting, but you also have to act, right? So empathy means telling the patient, I'm sorry to hear about your problem and I'll surely help you out. So little bit of empathy, sympathy, the way you talk, communication, not a speech, not a lecture, but more of a two-way interaction, or as well as obviously making sense on the diagnosis and treatment planning, answering patients questions. They are observing you and they are marking you on that. So you have to do all this in 7 minutes. Okay, that's an actor OSCE. Skilled OSCE, they will tell you any skill to perform, like suturing, rubber dam, um, X-ray holder. There are various skilled OSCEs. So whatever skilled OSCE is required to be done, you go inside and you perform the skilled OSCE. An examiner will be again observing you, and the examiner will be looking at your step by step performance again in 7 minutes. Okay, so you need to make sure that you perform the skilled OSCE. While performing the skilled OSCE, you should be very, very sure about the health and safety guidelines, where to throw the sharps, to make sure that you're not hurting anybody, making sure that you wash hands, wear gloves before you start the skilled OSCE. So there are various guidelines for every skilled OSCE which you need to perform step by step. Okay. Secondly, doing the skilled OSCE in 5 to 7 minutes is a little tricky, because you're anxious, you're stressed, the examiner is looking at you. So a lot of people's hands shiver on that day. And it is completely okay. Everybody will be nervous, obviously, if someone is observing you like so keenly. So how do you make sure that you overcome this? By lots of practice. You practice it so many times on daily basis that when it happens in the exam, it looks like it's another day where you're just doing it. Okay, so make sure part 1 was all about by hearting stuff. Okay, part 2 is not about by hearting stuff or reading textbooks. It is more about interaction, it is more about clinical application. Okay, so here the key is practice. And yeah, so this is how it will move in a circuit. So I talked about actor OSCE, written OSCE, and skilled OSCE. I have not talked about medical emergency OSCEs, which I will talk as I mentioned in a minute. Okay, so these are the different three types of OSCE. So far, all good? Anybody has any queries so far? All of you okay with till here? Should I go ahead? Okay. Now, what is medical emergency? Now, medical emergency in ORE is very simple. There's a viva, and you have to answer the viva. And it is simple because you're talking to the examiner. But in LDS, they make it a little tricky by not giving you the examiner directly, but by giving you the patient. Okay. But the patient, for example, say the patient is suffering from angina. Okay. Is the patient really suffering from angina on that day? No. Obviously, he is just enacting that he is having a angina attack. So when you go inside to perform, you will be telling that, okay, I think the patient is having an angina. I will check A, B, C, D, E. And now, as I have diagnosed it as an angina attack, I will calm the patient. So you start calming the patient. Please don't, whatever your patient's name is, say your patient's name is Mr. John. Calm down, Mr. John. Please don't worry. You're having an angina attack, but we are surely going to help you out. Okay. So please take deep breaths and everything is going to be all right. And then you will tell the examiner, now I'll go and get the GTN spray from the medical emergency kit. So you will have a medical emergency kit there. You have to pick up your GTN spray and you will tell the examiner that I will give, or you have to tell your actor patient that I'm going to give you one to two sprays under the tongue. Will you really give the patient spray under the tongue? No, because this patient is not a real angina patient. Okay. And then you will tell the patient, I'm going to give you oxygen, 15 liters per minute, so you can take out the oxygen cylinder. The examiner may tell you, show me how you will be using the oxygen cylinder. So you will do everything. Obviously, you will not put the mask on the patient, but you will do everything, how you will switch on the oxygen cylinder, how you will connect the mask, everything you will do. And then the examiner may ask you a few more questions like, okay, so Dr. Shabana, you gave GTN. Can you tell me the mechanism of action of GTM? Can you tell me the advantages and disadvantages of GTM? So the examiner may ask you questions, may not, and they may just tell you to step by step take care of the patient. Or after 3 or 4 minutes, the examiner may start asking you more questions on the medical emergency, just in case he feels or she feels like he needs to know more from you before he can pass you. Okay. So rather than just talking to the examiner, here you will actually have a patient whom you will be talking to. um, um, I think LDS people have done this because on the day of the when you really have a medical emergency on your clinic, if you have enacted it before, you may have some, experience on that day. ORE, it is much simpler because you're just talking to an examiner. You don't have to think so much. What will you do in angina? I will do this, this, this. Why will you do this? Because of this, this, this. So it's much, I would say for ORE, it's a little simple as compared to LDS. But at the end of the day, the core concept of both of them is same, that they want to see how you're going to take care of an ME. So for ME, I would say communication is important, but theory is also important. You should know which drug to give, how much to give, in which scenario. And you should know in which scenario what you're expected to do, what you're expected not to do. Okay, so theory knowledge for medical emergencies is very important. So that is your ME, which is a part of the OSCE. Okay. Now, how are we going to teach? So, OSCE component, I believe a lot of you have already taken our OSCE courses from the batch. So, just a second. Sorry. Yeah. So OSCE guys, we will be having a full OSCE course where we will have OSCEs divided into actor OSCEs, written OSCEs and skilled OSCEs. Medical emergencies will not be a part of OSCE. We will conduct it as a separate course by an LDS tutor. Okay. So OSCEs will be actor OSCEs, written OSCEs and skilled OSCEs. And for actor OSCE, we will be providing you with live classes if you're wishing to, if you have the time to attend. If not, you always have an access to recorded access, and we will be providing you with the hard copy notes. Our intention in Actor Oskies is not to make you by heart the notes, but make you understand the communication part of it. Okay? Yeah, I'll come to it. So first, let me talk about the Actor Oski. So in Actor Oski, we will be having different scenarios. Okay, so we have around 65 Actor Oskis now. It says 60, but now we have made it 65. In 65 actor OSCEs, 40 will be done in live classes. Okay, 40 to 45 are done in live classes. Rest of them are not done in live classes because we call them as pilot OSCEs. Okay, pilot OSCEs means not very important, but that does not mean you just leave it and go because it's not important. We will provide you recorded classes for all the OSCEs, and 40 will be done in the live class. In the live class, if you're an option 1 student or if you're an option 2 student, there are various options which you can see later on. If you're an option 1 student, you can actually make a presentation of the actor OSCE, and we will be assessing you there and then. But option 1 is only given to the first 6 candidates who join us, and for the next 2 batches, we are full on option 1 seats. So, what do I do? How do I join? You join the option 2. Option 2, you can attend the live class. You cannot make a presentation in the class because we have already promised that to option 1. But you can send us a recording of your presentation. So you record your presentation on WhatsApp or anything where you want to record and send it to us privately on WhatsApp, and we assess it for you in 24 to 48 hours. Assessing means we tell you how to make it better, like you're very fast, you're very slow, or you're using a lot of jargons, or don't do this, something like that. Okay. And for all these OSCEs, you will have hard copy notes. Skilled OSCE. Okay, somebody asked how do we do skilled OSCEs. In skilled OSCEs, we have made Planore has made videos for all these OSCEs. So in the class, we will explain to you step by step how to do the OSCE. Then we will play a video. In the video also, we will step by step explain to you how it needs to be done. Okay, like if you are explaining suturing, hold this, do this. It's all shown in the video, and we will also be talking with the video. And then you obviously have notes. We will also be telling you how to practice at home. Should you buy that OSCE or should you not buy? Most of the we will tell you the most important OSCEs which need to be bought by you. Even if you're taking any other course outside which has a hands-on practice, you still will have to buy certain important skilled OSCEs because you have to practice them, guys. In a hands-on course, you may get the chance once to do it or maybe twice, but you have to practice it so many times that on that day, within 7 minutes, you should be doing it in as fast as possible without any stress. That will only come with practice, and for practice you will have to buy. Okay. So we have 15 skilled OSCEs, Dr. Natasha, so we will be telling you to do all of them. Okay, so we have a list of skilled actor and written OSCEs. Okay, no, we don't have an hands on till now. We have not started any hands on, so there's no hands on at Planore for now. Okay, yes, maybe in the future, but for now it's all online. Okay. So that is your skilled OSCE. For your written OSCE, again, in the class, we will make you understand the concept. A lot of students just by heart the answer and question and go. That does not work because if in the exam a different way of written OSCE is asked, what will you do? The by hearted answer will not work. So we will explain you the concept. For example, if it is BP, basic periodontal examination, we will explain you the entire BP, how questions will be asked, how to answer step by step, and then we will give you a homework on BP. where we will say give you a set of 15 to 20 questions, and you have to practice writing them in 7 minutes. So a set of 7 questions in 7 minutes need to be done by you as a homework, and then you can cross check your answers at home. So we will provide you with the questions and answers documents. Okay? And the concept and how to answer the questions, what are the different ways examiners ask, and how to approach the OSCE in 7 minutes will be taught to you in the class. Okay? So written, actor, and skilled. In the live class, we will be assessing you. I mean, if you're an option one student, you can put on your webcam and your audio when you have to practice, and then we will give you the comments after the practice. So we will explain the actor OSCE to you guidelines, and then one of you will perform it. Okay, only option one students will get to perform in the live class. Option 2 students can send a recording after the class, and option 3 students are those students who don't require our help. They, in that there is no feature of sending recordings at all. So you choose according to what you think is the best for you. Okay. So yeah, that's for the live class. And what else? Okay, now for ME. Now, because we have so many LDA students now in Planwari, we have decided to start the ME for LDS. We did have ME for ORE, but now we are going to start ME for LDS, where we will have 4 short classes. In those classes, we will tell you how to talk to the actor patient for 13 medical emergency scenarios, as well as we will tell you how to use certain equipments like oxygen cylinder, intramuscular injections, AED, CPR. All the important things will be taught to you in those set of 4 classes. So here the ME will be slightly different. It will be separate for ORE. For ORE, we have a separate 4 class session. For LDS, it will be taken by a specific LDS tutor who will teach you how to do ME scenarios in a LDS style, in an OSCE style. Okay. And again, notes will be sent to you via hard copies. So for all these components which I talked about, you will always receive hard copies at your place. Okay. Okay. And that's for your ME. Now coming to unseen cases. Now this is the second component. In OSCEs, any problem so far? Okay. Now in unseen cases, I don't know why they call it unseen cases. It feels as if, it is like out of the blue. But it is basically the same diagnosis and treatment planning of the normal cases which you see in your dental. Okay. I'm not sure, doc, but they usually give more actor OSCEs. Written and skilled are usually less. Okay. But as I told you, because LDS has completely changed its structure, we will only get the best idea after they conduct their first exam in September. Okay. So till now it has always been more of actor OSCEs, but because the structure has changed, we are not really very sure because of COVID have they changed anything or anything like that. So the best case is I would advise you don't give the September exam. I would say wait for the September exam to happen and then give the December, because you'll get an idea on how it will happen. Secondly, if you have just passed out now, I would say December is a good thing because you have 4 to 5 months to prepare nicely for the exam. Okay. But yes, obviously, it is not me who has to decide, it is you. Some people may think that September is the best go because maybe December you have other plans. So that's fine. But just make sure that still now we have not got a really very good idea of the structure change. Okay. So let's hope by September we will. Okay. Sorry. So the unseen cases, guys, is basically history, taking history from the patient, investigating your problem, diagnosing your problem, and giving a treatment plan. Okay, again, it is the same as diagnosis treatment planning in ORE, but it's a little different. Here you have 4 short cases, and every case is 30 minutes long. Okay, Not exactly 30. Uh, in the LDS guideline, it actually says 32 minutes. I think they give 1 minute in between just because they don't want to. I mean, if there is a waste of time in giving you some material, they calculate it as 32 to 33 minutes. But the amount of time actually is 30 minutes, 10 minutes for taking a history, 10 minutes for making a preparation. I will talk about these three components, and 10 minutes is the management. But in that case, you have four cases. So 30, 30, 30, 30. That's a 2 hour long session. Okay, so you have three parts for every case. Now, what do you do in the first part? In the first part, you get to meet your patient and you take a history from the patient. Say, for example, the patient is suffering from pain in the lower right region of his mouth. So, you take the personal details of the patient. Okay, you ask about the pain and you ask more questions about the pain because you have to make a diagnosis, right? So, you ask like character of pain, pain on hot and cold, do you have pain on biting, do you have swelling, do you have foul taste, do you have mobility, how long does the pain last? Is it intermittent? Is it continuous? You ask various questions, right? Because you want to make a diagnosis. Then you ask some questions about the patient's dental history, medical history, social history, extra history. Okay. So we will give you a full questionnaire for all your history questions. Now the point is in LDS you get a plain sheet of paper. In ORE you have a template. So again it is easy because you don't have to memorize that. In LDS you don't have a template. It is plain sheets of paper. So you have to memorize the template that how will I ask my patient questions? I will first ask name, date of birth, then I'll ask the problem, whatever the problem is, I'll ask more questions on that, then dental history, then medical history, then social history, and then any extra questions if I feel to. Okay, so you will take history in 10 minutes. After that, the next 10 minutes, which is your preparatory phase, is uncertain. Why I say uncertain is because it will differ from case to case. In some 10 minutes, you will be asked to write the investigations which you require, like you require vitality test, percussion test, what x-rays you require, or they may ask you to write a treatment plan for the patient, or they may ask you to write a radiographic report, or they may ask you to write a referral letter for the patient, or maybe a prescription, or they may tell you the patient will ask you questions or the examiner will ask you questions. They will tell you this, okay? What you're supposed to do in that 10 minutes for that specific case, they will tell you. It is not like they will tell you to do this only. It can be anything. One case will be write investigations, diagnosis, treatment planning. One case will be write radiographic report. One case will be write referral letter, like that. So whatever they tell you, you do that. After those 10 minutes, you will again meet the examiner and the patient. Okay, that would be a final phase. And this would again depend. If they had told you that you will be asked questions by the patient, so prepare for that, or you will be asked questions by the examiner, prepare for that. So you've already prepared for it. Now, in this phase, they may tell you to either talk back to the actor patient that, see, you had pain, so your pain is irreversible pulpitis. Then you explain what is irreversible pulpitis, you explain the treatment options, you make sure that you explain the patient everything, what the patient requires, what is the treatment planning, what are his options, what are the advantages and disadvantages of every option, everything. Or they may tell you don't talk to the patient, answer examiner questions. The examiner may have some questions and you may have to answer that. Okay, so that would again change. So DTP of ORE is very what you say, do this, do this, do this. They already know what needs to be done at every stage. LDS, this can also be there, this can also be there. So you will have to prepare. When we do the course, we will tell you how to prepare for preparatory phase and for final phase because every case can be different. So you should be ready for each and everything coming your way. Okay. So like that, you will have four cases of 30 minutes each. Now, how are we going to teach? Again, so far, all our LDS students have only taken the DTP with us, And we have always tried to get back to them for feedbacks, and they have always said that the, it has completely helped for unseen. But now we intend to start in August with an LDS tutor. We intend to start unseen cases as such. So now we know how unseen cases also work. And an LDS tutor will be for only for the unseen cases and the ME component of your OSCE. So how are we going to do it? We are going to take 8 discussion classes. Okay. These 8 discussion classes will be just discussion, general theory classes. What 8 topics we are going to discuss is perio, pain, NCTSL, ulcers, swelling, prosto, white and red lesions, discoloration, and some miscellaneous cases. What is this discussion? For every topic, we will tell you uh, how to approach perio cases, how to investigate them, how to radiograph them, how to treatment plan them, and how to talk to the patient. Again, for pain, we will talk about the same. So basically, we'll give you an overview of the entire topic. Rather than giving you a case, we will first talk in general, overall, for the entire topic so that you can strengthen your concept. Okay, so those will be your 8 topics. And then we will have 20 unseen cases like it will happen in the LDS exam. Now, again, talking to the LDS tutors, talking to the LDS students, we have realized that unseen cases is supposedly always having the same unseen case. That means they don't change. It always comes from the past. Unless they decide to do something new this year, so far it has always been from the past. So there you have an advantage over ORE. ORE is not like that. They may give you a very complicated case, they may give you a very simple case, so it's your luck. But in LDS it is said that it is always from the feedback. So all the 3 LDS tutors we are in touch with now for your courses, all the 3 have told the same. So good, and they have said these 20 unseen cases should be more than enough for you to cover everything. So 8 discussion topics to understand the concept, 20 unseen cases to practice for those concepts. At the same time, if you have been with us with Planwari for a long time, you must have seen we always tell you do everything, cover all your bases, because we don't want you to fail just because something unpredictable comes in the exam. That is why we tell you to always strengthen your theory. If your theory is strong, guys, if your concept is clear, even if the case comes in a slightly different way, you will still be able to approach it because your core is good, your understanding is good. Okay. So, yes, we will do 20 unseen cases in the live classes, and again, you will have notes for that. Whenever we do the case, we will do it like it happens in an exam. That means 10 minutes, 10 minutes, 10 minutes. So, 30 minutes for every case. And we will do 3 to 4 cases in a class, approximately 3 cases, because we know students will have queries as well for every case. And we will do it in exam like timings. Again, only option 1 students will be able to make a presentation or take a history. Option 2 students can send a recording of the same. Okay. So option 1 student can you can put on your webcam or whatever, and then you can we will have a face to face interaction where you will be the actor patient, sorry, where you will be the candidate and I will be the or your LDS tutor will be your patient. Okay. Now for OSCE guys, we are already full on option 1, but for unseen cases and ME, we still have not opened that slot of option 1, so we will surely open it in some time. Yes, option 1, Dr. Hira, you will have to attend the live class, because if you have to make a presentation in the class, it has to be live, right? If you're not sure about attending a live class, then we would tell you to join option 2, where you can send us a recording of your presentation. Okay? And if you don't want any practice, you're confident about talking to your actor patient, you can just take up option 3, do the recorded classes on your own. Okay? So you will have total 7 classes for unseen cases and you will have a total of 8 classes for discussion topics. So a total of 15 classes for unseen cases. And yeah, I think that's it. So, why should you choose Planwari? Because the ones who have already been there with part one, you already know that we always make sure that we come solve all your queries. So for us, more than I think more than a student joining, it is the passion that most of the tutors, whenever we hire tutors at Planwari, we make sure that the person is very passionate about teaching. Because if that is not there, then there is no driving force to keep us going. So I think that would be one of the main reasons. But we would always tell you to take a free 24-hour trial with us before you choose us or any other course. And if you think Planwari is the course which suits your needs, then please take a trial with us and then join one of the options which you choose to. Now, any of you who wants to appear the exam in September, is there anybody in the class who wants to appear the exam in September or is looking forward to? Because if you are, then I will explain how the course will work for September. But in case you're looking for a December, then I think the August to October course would be perfect for the December students. But in case you're looking for the September exam, please contact us privately. So I will tell you how for September candidates we will be trying and making sure that everything is in your account before the September exam, before the October exam. Sorry. Okay. So that's it. Anybody has any questions or any queries? Somebody has raised the hand. Dr. Madhuri, if you want, you can just put your question in the chat box. Okay, so if nobody has queries, we can log off. And if anybody has queries, let me know. I'll try and answer it. If you want, if you want to start, give the exam next year, then also I would say start the preparation as soon as possible. Now, why? Because as I told you, practice is the key to success. So, Dr. Madhuri, the earlier you start, the better it is. With Planwari, the advantage is you have the course access for 20 months. So whether you're giving the exam in 2023 or whether you're giving the exam in 2024, we will always be there with you for 20 months. Okay. So why not take advantage and join early rather than joining at the last minute? A course fees, Dr. Shabana, I'll send the link. I have added you all to one WhatsApp group. So I will send the options and the fees there because according to different option, the fees differ. Next exam is in October and December. Okay, but I it is not on the website. The October and December exam dates have been sent to us by a candidate who had to give her exam in June, but it got postponed. So now she has a choice to give it in October or December. So it is, I think, only for the already booked students. I'm not really very sure if it is going to open for the other students. So just maybe email RCS to ask about the details. Okay. Course fee, Dr. Shruti, I'll be putting it on the WhatsApp group. So you'll have an idea there. But all of you take a free trial before as well. I think you have to wait for their email, Dr. Shabana, for the part 2 exam. But why not email them and ask them how to go about it? Okay. What I think is, okay, this is just my imagination, okay, from whatever I have experienced with the LDS. Now, the people who were already booked, they have been given the slots of either October or December, right? They have been given these two slots. I'm just giving an example. Say 50 people have been booked for this exam. Okay, 25 choose October, 25 choose December. So you that LDS people will see, right, that they say they have 50 max slots for it. I'm just giving a very lame example just so that you understand. Say they have 50 seats, but only 25 people have enrolled. So they have 25 remaining. I think these remaining seats would then be offered to the candidates who just passed their LDS part 1 or who are maybe outside the list. They are still not on the booking list. That's what I think. Okay. But best is to email the RCS and understand what's going on over there. No, next year I don't have an idea, Dr. Shruti, because usually the exams used to happen in Jan and August, September for LDS. But because of the structure change, they have increased the number of exams, and they have not really been very clear on when they are going to do that. So it would be very difficult to take that guess. Yes, it has not happened. So I think the last exam happened in Jan 2020 for LDS. The advantage of the live classes, some students want to get assessed on that day. See, in a live class, I'm talking to you, right? Now, if you also put on your cam, it will be like a face to face interaction. If you are watching a recorded class and then you're making a recording, so there won't be any person there in front of you. Okay, but it is up to a person. See, we cannot tell every person to attend a live class, and we cannot tell every person to stick to recorded. So it depends on your priorities. If you think live class is not something what you can attend because maybe you're working, you have a job, you have a baby, whatever the reasons may be, stick to recorded. I don't think recorded classes will have an issue at all, because as long as you're watching the recorded class, you are understanding and you're asking the queries on the WhatsApp group, it should be fine. And you can send the recording of your presentation. This recording can either be a video recording or an audio recording, but you should not send it to us on our group. You should send it to us privately so that it does not get leaked. Mm, so the OSCE I will be taking, guys. Okay, but the what you say, the unseen cases and ME will be taken by a different tutor. Okay, so once she is on board, I'll be able to tell her name and all. But for now, we already have one on board. But once everything is finalized, she will be taking your LD unseen cases and your ME. OSCEs I'll be taking. Okay. Any other queries? No, no, no. It will be a group. In option one also there will be a group, guys. But now see, you're a group, right? Now you're a group of 12 people, right, Dr. Hira? Okay. Now, in this group, say Dr. Hira, Dr. Shabana, and Dr. Madhuri are option one students. Okay, I'm just giving an example. We have six option one students. So, whenever you do a case, I will say, Dr. Hira, you will be making the history for case number one. Dr. Shabana will be making the history for case number two. And Dr. Madhuri will be doing the history for case number three. Okay. Now, say Dr. Sanna and these people are also there in the class, but they are not option one students. Okay. So, the option two students in the class will be there in the class, will do the case, will see everybody else performing. The only thing what they cannot do is they cannot make a presentation themselves because they are option two. So, they will be sending a recording of their presentation if they want us to assist them. Okay. Is that okay, Dr. Hira? So that is why we tell take a 24-hour trial. When you take a 24-hour trial, you will see the class. So you will understand what I'm saying, because in the classes there are already option one, option two students sitting. So you will understand what I'm trying to say. Okay. My name is Shweta, Dr. Shabana. Okay. For option one, few students will be able to present, so their presentation will be recorded and we will be able to. Yes. Yes. So the option one students, when they are in the class, that class will be available for option 2 and option 3 as well to see. So even if Dr. Hira is making a presentation, Dr. Sanna, everybody else will be seeing her, obviously, as well as everybody who gets the access to that recorded class will also be seeing. So option 1 students will be making a presentation in live class which will be getting recorded. So yes, you will have an access to that, if I have answered your question correctly, Dr. Sanna. Option one is full for OSCEs. Okay, but option one is still not full for unseen cases and ME. Okay, because we have still not opened it on our website. Once we open it, it will start getting filled. So that slots will open next week. Okay, maybe you can register with us, but we will be only open the bookings next week. But OSCEs are full. Yes. So no, nothing like that, doc. So the batch is August to October. Okay. We have another batch from November to December, November to January. Okay. Now, November to January batch, if you want to take up as an option one seat for OSCE, you can, because for that we still have available seats. Two seats are still available in November to Jan. So you can take it up that time. Okay. But it will again depend when you're giving the exam. Because if you're giving the exam in December, then there's no point joining November to Jan batch. You're getting the point? You're understanding what I'm trying to say? So, if your exam is between our live batches, just take up option 2 rather than taking option 1. Okay? Which date? It is starting on the 19th of August. We have an intro class for the batch, and it should start around 22nd of August. So, it will be from 22nd August onwards. Okay, because we'll be closing for a summer break, so we will only be resuming work on 19th of August. Got it? Okay. Any other queries? Okay, so all well. So do take a 24-hour trial, guys, because all the questions which you asked, hopefully the trial will clear it out. What is recording? What is option one? What is option two? Okay. And when you take a trial, I will call you privately. So when you know these questions that I'm giving exam in December, what should I do? I'm giving exam in May, what should I do? Then I can, according to what you need, I can tell you what to join, what not to join. Okay. So that's it, doc. So have a great day ahead. And we will put this recording for all the Planore students and hopefully for the free students later on YouTube. Okay. So have a great day ahead and all the best, everybody, for part two. Bye bye.